In today's video, we'll talk about a very important yet still little known topic, the role of the gut microbiome and the gut-brain axis in the process of tapering off psychiatric medications and recovering mental health. More and more research shows that the microbiome, the community of trillions of microorganisms living in our gut, not only supports digestion but also actively affects the brain. These bacteria produce neurotransmitters such as serotonin and GABA, regulate the immune system, and generate anti-inflammatory substances. This means the microbiome directly impacts mood, emotions, memory, and concentration. The gut-brain axis, which is the communication network between gut and the nervous system, is the pathway through which these signals affect our mental state. And now the interesting part. In the context of tapering and recovering from psychiatric medications, this relationship becomes especially important. Many people experience what is called protracted withdrawal syndrome, a condition in which symptoms such as anxiety, insomnia, mood swings, and concentration problem persist for months or years after stopping the treatment. Some patients also develop PSSD, which is post-SSRI sexual dysfunction, an issue that is being increasingly recognized but still lacks effective treatments. Fortunately, a team led by Dr. Malkangi is currently testing the gut-brain axis hypothesis as a possible explanation for PSSD and PFS. In my own practice, I've also observed that many clients struggle with dysbiosis, and when we address it together, their recovery process becomes less painful. So now the question arises, can the microbiome play a role in the healing? Research suggests that disrupted gut flora may suggest inflammation and neurotransmitter imbalances, making it harder for the nervous system to stabilize. Dysbiosis in the small intestine is relatively common in people who have taken psychiatric medications long-term, leading to impaired neurotransmitter production and poor absorption of the key vitamins such as D3, B12, and folic acid. On the other hand, supporting a healthy microbiome through the diet rich in fiber, probiotics, prebiotics, and fermented foods may help regulate the gut-brain axis. This, in turn, can ease withdrawal symptoms, support nervous system recovery, and improve cognitive functions such as memory, focus, and learning, all of which are often impaired after discontinuation of psychiatric medications. There is also growing evidence that probiotics can support the body both during tapering and protracted withdrawal. During tapering, the body faces neurotransmitter dysregulation and heightened stress response. Probiotics, especially strains from the Lactobacillus and Bifidobacterium, have anti-inflammatory properties and may stabilize the gut-brain axis, reducing anxiety and depressive symptoms. And during protracted withdrawal, when symptoms like brain fog, sleep disturbances, memory problems, and persistent anxiety continue, modulating the microbiome may support cognitive recovery and nervous system regeneration. Some studies even suggest that probiotics can improve working memory, focus, and reducing inflammatory marker, thereby supporting the overall recovery process. By treating the microbiome as an ally, we may increase our chances of achieving fuller recovery. Gut balance is a body balance, and in the long run, it may be a key factor in regaining full well-being after challenges of psychiatric pharmacotherapy. In conclusion, it is worth knowing that by supporting the gut, we are also supporting the brain and the entire healing process.